There is a difference between a person who is dying and a person who is suicidal. I do not want to die, I am dying. Imagine that you are bedbound in excruciating pain, unable to walk, talk, breathe, or even eat alone. You feel like a burden to your loved ones. You just want it to be over. But everyone is telling you you'll be okay. In reality, you know what is coming, and ultimately have to suffer through the excruciating pain that no drug is able to relieve. You just have to wait till the end, whenever that is. Hello, my name is Christina Thompson, and I am going to persuade you that physician assisted suicide should be legal for terminally ill patients who have less than 6 months to live. I would like to educate you on exactly what physician assisted suicide or death is. According to the ERLC, physician assisted suicide occurs when a physician facilitates a patient's death by providing the necessary means that enable the patient to perform the life ending act themselves. Now, I'd like to point something out. The difference between physician assisted suicide and euthanasia is that physician assisted suicide is providing the lethal means for the patient so that they may choose when to use it. Euthanasia is when the physician takes an active role in the patient's death and involves intravenous delivery instead of using some type of lethal substance. Furthermore, terminally ill patients should be able to choose their own path. Physician-assisted suicide should be held within the right of the patient, not the law. Let me briefly explain why. Terminally ill patients should have the right to assisted death because it is the best way to end their pain caused by an illness that cannot be cured by any drug that exists. A competent terminal patient should have the right to decide how they want to spend the remainder of their life because it is in the best interest of the patient. According to the CNN, physician-assisted suicide is legal in 9 U.S. states and the District of Columbia. It is an option given to individuals by the law in District Columbia, Hawaii, Maine, New Jersey, Oregon, Vermont, and Washington. Patients must have a terminal illness and a prognosis of 6 months or less to live. Physicians cannot be prosecuted for prescribing medications to hasten death. If physician-assisted suicide is legal in these 9 U.S. states, why is it not legal in all of the United States? Don't you believe it should be held within the right of the patient? Now, there are 3 things I would like to make apparent to the public. Firstly, a terminally ill patient doesn't want the cost of their care to be the responsibility of their loved ones when they are gone. They don't want their loved ones having to worry about finances when they are suffering through losing an important person in their life. Allowing physician-assisted suicide to be legal drastically reduces the cost of their medical care by thousands of dollars. Secondly, terminally ill patients should not have to sit and suffer through the pain and have to take on the burden of watching their family grieve from seeing them in pain. They do not want their family to watch them as their health slowly deteriorates. They want them to remember the person they are and not what the disease is doing to their body. Thirdly, a terminally ill patient should have the right to die with their dignity and have the choice whether or not they want to suffer through hospice care and continued medical care. Now, I'd like to get into another reason why it should be the right of the patient to choose how they want to die. A terminally ill patient knows that hospice is coming. There may be ways to make them comfortable, but how long? Some terminally ill patients have such unbearable pain that no drug out there can alleviate it. I'd like to talk about a patient that was interviewed. Brittany Maynard, diagnosed with terminal brain cancer, chose to end her own life on her own terms, instead of suffering the remainder of her time in hospice. She originally lived in California, but physician-assisted suicide was illegal in that state. Brittany and her family moved to Oregon because she wanted the right to choose her own way of dying. I believe that the goal of healthcare should be to honor all of their competent, terminally ill patients' wishes and let their lives be in their own hands. When I interviewed the family of Brittany Maynard, they stated that they believe fully in the death with dignity, and they believe that it is fully misunderstood by many people in the community. They plan to continue to fight the past fight to pass the aid in dying legislation in more states. Finally, we should be able to respect, value their wishes, and save the dignity of individuals who are terminally ill and have less than 6 months to live. I believe that physician assisted suicide should be legal in the United States. Now, that we've talked about the main reasons why physician assisted suicide should be legal, let's talk about the reasons people do not want to legalize this act. People believe that suicide is not medical care. I believe that doctors should be able to help their patients die a dignified death. They are just doing what their patients wish. Another reason is that palliative care specialists believe there's another alternative. There's only so much we can do for a patient that is terminally ill to keep them comfortable. Sometimes our means of giving them care just isn't enough. They don't want to feel the pain or put their families through it. I believe that they have the right to do that because with a competent mind, it is ultimately their choice to make. Physician-assisted suicide is arguably one of the most controversial topics in the medical and legal field. However, when it comes to respecting the patient, maintaining their dignity, and making them feel like they are in control of their life, I feel as though this is the most important thing. If you were put in their shoes and you were suffering from an incurable and painful disease, wouldn't you want the right to be able to choose if you want to continue to suffer or be able to choose physician assisted suicide on your own terms? In conclusion, I believe that a competent terminally ill patient should have the right to choose physician assisted suicide to end their suffering, take away the financial burdens that their loved ones are left with, and to end their life with dignity that they deserve. Now, if you believe that physician assisted suicide should be legalized in Ohio, please stand with me. There is a difference between a person who is dying and a person who is suicidal. I do not want to die. I am dying. Thank you, everyone.